We have the mission and the vision to produce outstanding physicians with a focus on rural and underserved Oklahoma, and we do that by starting residency programs that have their grassroots in these areas. We know that residents have a tendency to stay within 100 miles of the places that they're graduating from. So if you have residency training programs in those areas, those individuals become committed to that community. They become committed to the individuals that they serve, and they want to stay. When we talk about growth, a lot of times we end up focusing on the isolated growth of residency training programs and fellowships. You can't do that without looking at the bigger picture. We know, number one, there's definitely a shortage of primary care physicians and specialty physicians that are being produced nationwide and statewide. We also know that in the last 10 years, there's been a 52% increase in the number of students through the undergraduate medical education continuum. Over the last 20 years, there's only been a 1% increase in the number of slots that are available for those students to actually train in when they've completed medical school. So you can see where the discrepancy is, and you can also see why 85% of deans that were surveyed, they have concerns about where their medical students are going to train in residency and fellowship. Take that one step further, how are we actually meeting the needs of the nation and meeting the needs of the state of Oklahoma if we don't have places for those individuals to train? So Oklahoma, particularly our university, OSU and OMECO, we didn't stop at the UME level. We know that we've got to increase the class size because we need more doctors, but we know that in order to increase the class size, we have to have places for those individuals to train. And we're addressing it because failure is not an option for us. It's not an option for the nation, and it's not an option for OSU and OMECO. We have had a very long-standing relationship with tribal health here in Oklahoma. We also know that the Native American population has long been subject to socioeconomic and healthcare inequity. We know that in order for individuals to return back to tribal health, we have to have a focus on residency training programs that actually exist in tribal nations, because they will understand that population and they'll understand that need better than everyone else. The landscape of healthcare is really changing. What we do know, and what is a fact, is that there is such a big shortage as far as primary care specialties and subspecialties. We've already proven our track record. We've increased the amount of residency training slots by 250, and we've expanded the number of residency training programs by 17. The best predictor of the future is the past. We have full intentions to meet the needs of Oklahoma by expanding residency training programs, by expanding fellowship opportunities. We'll use our resources to make sure that this is successful. We will put one physician minimum in every single one of the 77 counties that exist in Oklahoma, and we won't stop until that's done.